about the current contract system for medical officers. Can you, Dr. Michelle, and Dr. Selina also, what are your views? And when you took a leap to leave clinical practice, how long did it take for you to make the leap? And was there a backup plan or a safety net that you had in mind before you decided to leave? And also, what are your advices for the current contract medical officers? Given the uncertainties and the current circumstances, there's a lot of things at stake at your career as a contract medical doctor also.
I think those days back in 2006, when I joined, we didn't have contract housemen and medical officers. So we didn't have that, and there were not say many, were sufficient number of people. But I knew that this was happening, you see. And I didn't make, I think I made a mistake. Looking back, I made a mistake that, I decided to just dive in and just leave without much planning. I planned, but I realized looking back that I was a bit hasty in my decision. And so that was one of my mistakes and trial experience I've learned. So my advice to the young people now is don't make the same mistake I did. Take some time to plan, and uh, you need the support. You need people who will back you up. um, I think that if you really want to leave, given the current situation, which I think there are more pull factors and also push factors now, um, see what is your next available step, what is your next available option. Anybody looking for a job, anybody looking for interns, anybody looking for partners, any available vacancies out there first. Try to scour and see what is available, because you also have technology and social media with you today that I didn't have much back then. So I think use those to your advantage.
Thanks, Michelle. So I guess the contract system, the thing is, we've always assumed that things would never change. When it's, once you become a doctor, that system was that everyone gets absorbed into the system, and we just assume that it's never going to change. But I guess that's something that we need to understand that everything is very dynamic. Life is just dynamic. It's going to change. It's just like the pandemic. Nobody expected it to come, and then it came, and it just wiped up some businesses. It caused some businesses to pivot. So that is just how life is. If you're going to just hope on the government to give you a job, I think that's very scary. So what I would advise is definitely pick up extra skills, like what Michelle was saying. There's actually, once you step out of that box, which is a hospital, clinics, that kind of feel, right, that kind of life, right, that where you are just seeing patients, you realize that you have a lot of gaps in a lot of places, like management, decision making. All these are skills that we were not taught. I mean, we just picked up along the way, but our skill is very limited to just treating patients. So I think if you're in the contract system, I would say you need to pick up another skill. You need to combine what you have as a medical doctor with something else that would make you stand up, that will make you unique. And when you go out, that's your unique selling point. That's what you can bring to the table. So when you come out, right, it's no longer what can you give me, but what I can bring to the table. It becomes a very different ball game. Because once you come and say, hey, I have this and this, I can help you to do this, people will say, oh, okay, yeah, we want you here. But if you come and say, hey, I want this, can you give me all this? Now, nobody is going to give you a seat at a table with that kind of mindset. So that is definitely something you can take away and think about it.